Hello, welcome to TCM Talk. Just getting the screen turned around. Hi there, I am Kirsten Cowan, licensed acupuncturist and herbalist here in Oakland, California. I'm also the creator of Angelica and Peony, Radiant Natural Health and Beauty products that I make using fresh herbal ingredients. Welcome to TCM Talk. Thanks for joining me today. Normally, I'm joined by my colleague, Denise Chikuto of Chikuto Acupuncture, another licensed acupuncturist and herbalist, physician of traditional Chinese medicine here in the San Francisco Bay Area. She's away on holiday today, so I'm going to be flying solo, talking about natural pain management techniques. I have a couple of topics I'm going to cover today, and Denise and I will be back together 2 Thursdays from today on August 18th to talk about some more stuff and what kind of things that traditional Chinese medicine, holistic and natural medicine can offer in terms of pain relief and pain management. Everything that we talk about during our scopes, everything I'm going to talk about today, you can find links to it on our Pinterest board, and the short link for that is bit.ly/periscope pins. I showed that at the beginning of the recording of the scope, and I'll show it to you again at the end. And you can also find archives of all our broadcasts on YouTube, bit.ly/TCM Talk Vids. So everything that we have talked about in the past, we record it and we put it up there. This will be up there as well if there's something that you missed. If you have questions, feel free to jump on with them. I welcome that as we go along. And if you're watching this on the replay and have a question that you would like two physicians of traditional Chinese medicine to answer for you about any topic, email us traditionalchinesemedicinetalk@gmail.com. So without further ado, I'm going to get right into my topic today. My topic is topical. I'm going to talk about topical treatments that offer options for pain relief and pain management. Hi, thanks for jumping on. Feel free to ask questions as we go along. I will do my best to answer, although I may have to crick my neck to read people's chats. So topical treatments are basically anything that goes on the skin. So they're useful for all kinds of pain. They can offer relief in some cases for systemic pain, and obviously they're really fantastic for local pain. Something with a joint or an injury, post exercise pain, that kind of thing. I make a lot of topical treatments with a pain and discomfort type focus in my company, Angelica and Peony. So I'll mention some of those, my favorites today, as well as some other traditional Chinese remedies and some homemade options. So the first type of topical treatment that you might already be familiar with, and be familiar even with the Western types, are balms, salves, and oils. I really have some of my favorites that I want to introduce to you today, and many of them are mentholated. Menthol is a crystal that's extracted from the mint plant. It's a natural way of extracting the volatile oils from mint plants, and it gives you that very sinus opening, cooling sensation on the skin. And is a base of a lot of pain relieving ointments that you might be familiar with, like Vicks Vapor Rub, or Tiger Balm is another Chinese one that a lot of folks are familiar with. So I love these types of things. They're really great for muscle tension, headaches, even discomfort that comes with cold and flu, stiff neck, stiff muscles. And so I actually make a couple with Angelica and Peony. In particular, I make one with a ginger base. That's this one, my ginger menthol balm. This is really great for that stiff neck and shoulders that comes with the onset of a cold or flu, and for headache, especially where there's a sinus component. It's great for respiratory stuff as well, but in terms of its pain focus, those are the types of pain it's really great for. Lots of folks do use it for muscle pain and stiffness. However, I prefer to use my warming menthol balm. This has some other Chinese herbs in it, like cinnamon, ginger, and mugwort, which are very warming, increase circulation, and are really great for helping to relax sore, tight, spasmed muscles. Both of them have that mentholated quality that provides a kind of instant cooling sensation of relief. Some other ones from the Chinese medicine cabinet that offer something sort of similar that I really like are this one. This is white flower oil, or bok fa yao. I actually got to know this quite well as a kid growing up in Hong Kong. It's from Hong Kong, a patent remedy from there. Everyone uses it. It has methyl salicylate in it, which is the active ingredient in aspirin. So it has quite a strong pain relieving action on the muscles. And you do want to be careful to be aware of how much you're using. If you did cover yourself head to toe in it, it would be possible to overdose on it, which most herbal topicals, that's not a concern. It's also really fantastic in the shower if you have intense headache, sinus headache, allergy, hay fever type headache with pressure. You can sprinkle a little bit of this in the shower and have a really fragrant steam that will really relieve pain or all over body aches. A similar one, this one's really banged up because I just have a little bit left, is Posum on oil. This is another very minty opening oil, great for headaches, sinus congestion, and kind of tension-related pain in the neck and shoulders. For more intensive muscle pain, especially maybe post-exercise, stiff neck, frozen shoulder, joint injuries, anything like that, I really like to use patches. Patches are, again, there's Western versions of these, but I find the Chinese medicine version to be the most effective. This is probably my favorite. I use this, very frequently, always keep them on hand. Always recommend them to patients. It does have menthol in it as well as wintergreen oil, which are two of those very opening and analgesic pain relieving components. And it also has an extensive list of Chinese herbal ingredients which relieve pain, improve circulation, speed healing, all of that kind of stuff. So this one, actually, it's a brand new pack because I just used the last one yesterday on a stiff shoulder. I like to put them on at night and sleep with it. And then when I wake up in the morning, generally if it's just a type of transient spasm or discomfort, it's usually gone in the morning. They do have a kind of a strong smell of menthol and a little bit of herbs. So you want to be aware of that if you're going to be wearing it out and about during your day. So this is what it looks like. These types of patches generally have latex in them. I'm just looking at the ingredients of this one, but I don't see specifically. But you do want to be aware of that if you have a latex allergy. Basically, it's the herbal combination, the menthol and the camphor combined together into this layer on some medical gauze. Actually, it looks like this one is made out of with a peel off top. So you peel that off and then you just slap it on the affected area, joint or muscle area, and leave it on for a number of hours. Super effective and very easy to do even when you're in a lot of discomfort. Another one that's also kind of from a lot of the Chinese medicine, pain relieving recipes and techniques and stuff come from traditional practitioners of martial arts. Understandably, getting bruised and banged up a lot. So a lot of martial arts schools kept their own recipes for things that are called like jiao, which are liniments, long soaked combinations of, sometimes dozens and dozens of herbs in wine or alcohol, which offer, bruise healing, even bone setting properties and things like that. This is one of the most famous pain relieving and traumatic injury relieving combinations in traditional Chinese medicine. It's called Yunnan Baiyao, and it has a very large percentage of Panax noto ginseng. Sanqi is the herb, which is stops bleeding. Really effective against bruising. So it's not necessarily the most effective in terms of pain relief. This would be more like really if you stubbed your toe, banged your shin on the coffee table, rather than a chronic type of pain or anything like that. And this is a powder called cut powder. I always keep some of this in my kitchen and in my first aid kit, because if you do cut yourself, you just sprinkle the powder on it. It staunches the bleeding very rapidly. But for something like a bruise, you can mix the powder with a neutral salve. I use my own basic balm, which is just a calendula-based salve, but you could use anything, sesame oil or even something like Vaseline, just to get it to stick onto the surface if you had a bruise. And it will speed up the healing of that bruise and take down the swelling. One of the other most important pain remedies that go on the surface of the body that a TCM practitioner might use or teach you about is moxibustion. Now, we actually have quite a few videos on in our archives, bit.ly/TCM talk vids about moxa, what it's great for, how to use it, and different techniques. So I'm just going to touch on it a little bit. It is great for both acute pain and chronic pain. It's a very powerfully warming, relaxing, anti-spasmodic, pain relieving technique. Good for almost, virtually every type of pain. And Chinese medicine, if you have been to an acupuncturist, you might have gotten this lecture before. In general, our approach is, we're much more going to favor heat for pain rather than cold. So we've been telling folks not to ice pain and injuries for a long time, and Western science is now caught up with this and has walked back their recommendations about icing even the acute phase of injuries. I have some links on our Pinterest board, bit.ly/Periscope pins, about the most recent studies, meta reviews of data and stuff that they've been doing, showing that icing, in fact, by reducing the inflammation and stopping circulation, actually lengthens the healing time. It does provide a kind of instant analgesic effect. It freezes up the area and lessens the intensity of the pain if it's an immediate injury. But beyond that, it really doesn't seem to have a benefit, and in fact seems to slow healing and the body's own repair mechanism. That's in fact what inflammation is. That localized inflammation is the body's resources rushing in to an injury, heating it up, speeding up bringing in the components that repair and taking away damaged tissue and so on. So we want to kind of support the body's own healing mechanism, fundamental principle of holistic medicine in general. And that extends right even into our application of topical medicines on the surface. So what I would recommend is, rather than reaching for an ice pack, reach for a topical menthol-based salve or oil, like one of these. Give yourself that sensation of cooling. You can breathe through an acute injury a little bit easier while not interfering with your body's own repair mechanism. So on to moxa. I'm just going to introduce this very briefly. Moxa is mugwort herb, so that's something that I actually have in my warming menthol balm. It's pain relieving and circulation increasing function is activated when it's put on the skin that way. But the most common way that we use it for pain relief is in this kind of form. This is my favorite type of moxa stick. Other acupuncturists might use some of the larger ones. There's smokeless kind, which look kind of like charcoal and are easier to use in environments where burning a lot of herbs would be problematic. Basically, you light the tip of this, and just like a cigar or a cigarette, it makes a hot coal, a kind of fragrant herbal smoke, and we hold it over the affected area. We'll often hold it over acupuncture points, run it up and down acupuncture meridians, but you can also just mox over a whole area. And as I say, this is fantastic both for acute pain and also chronic pain conditions. Respond really well to moxa. It's very supportive, very nourishing for the body. Your body, gets help in doing its work. It's a very relaxing type of treatment. This is another device. It's seen some use. This is called a belly bowl. And it's another way to do moxa over a bigger surface. So you could do this on a low back if you have an aching low back, on your hips sideways or on your stomach. Great for menstrual cramps or digestive discomfort. And we use these pressed sticks of moxa, kind of like incense, that go into the belly bowl. We light that and it gives a big area of warmth, healing, and relief. So I think that's, I have a little bit more to say about poultices and compresses, but I'll just go briefly onto some of my favorites. So this is a whole area of study, both for Chinese herbalism, Asian herbalism, and traditional Western herbalism. Love to use all kinds of fresh or dried herbs, mashed up or cooked together or mixed with oil and held onto the skin or body part with cloth to relieve pain. Very classic one that some of our grandmothers might have done would be a mustard plaster on the chest for chest pain and coughing. And some of the easiest ones to do at home that are my personal favorites, very easy but very effective, would be for headache, a lavender essential oil compress. And you're going to do that just by using a washcloth, either cool or warm water, not cold, not hot, cool or warm, depending on how you feel. If you're feeling overheated, then cool would be the prescription. If you're feeling very chilled, then warm would be appropriate. Few drops of lavender oil, just 2 or 3, or even 1 drop of lavender oil on the compress. Put that on the back of your neck or over the forehead, and you're going to activate those acupuncture points that help relieve that headache, especially related to tension. Another great one for eye pain is chrysanthemum compress, and I like to use, I have a little thing here. Here it is. So basically, you're just pouring some boiling water over chrysanthemum blossoms. These are pretty easy to get at an Asian grocer or a nice health food store, and make tea with them. Let the blossoms cool, and then I like to use these little muslin tea bags. They're just perfect for making this type of compress. You stuff the blossoms inside, and then it's perfect to hold over the eye. This would be for swelling, pain of the eye from allergies, or something like a stye, an infected tear duct, that kind of thing. You can hold the compress over your eye. So I hope this has been interesting and helpful introduction to a few of my favorite topical remedies for pain, acute and chronic, that traditional Chinese medicine and holistic medicine have to share. Once again, everything I've talked about can be found online on our Pinterest board, bit.ly/Periscope pins, and you can find archives of all our broadcasts, bit.ly/TCM-Talk-Vids. I'll be back in just a couple of moments with a second scope talking about traditional Chinese medicine food, combining food concepts for pain relief and pain management, and share a few insights with you. So I hope to see you soon. Thanks so much for tuning in or watching on the replay. You can always email us your questions, traditionalchinesemedicinetalk@gmail.com. Bye-bye.